Okay, hello and welcome back to the Right Brain Podcast. We're sitting on these fancy new chairs that Jack ordered, and my dad is concerned because green stimulates the right brain.
Well, actually, green,
I thought it didn't.
Green is pretty neutral. It does stimulate the right brain more, it seems. That's what research seems to show. But it's also pretty neutral, meaning that the earth is the primary color of earth is green. But if you look at it on the color spectrum, light, we have three that are, red, yellow, orange. On the low frequency, we have three, blue, violet, indigo, that are on the higher frequency, and green is right in the middle. So I guess if you're going to have it, a color, green is kind of neutral.
Yeah, he's nervous that it's gonna like it's not going to be good for our right brain listeners to have a color that stimulates the right brain. But let me ask you this. Would a right brain person rather they look skinnier on camera or be worried about maybe they're, having the wrong color in front of them?
That's easy. A right brain dominant person would absolutely give up being skinny over anything, right? Meaning want to be skinny versus anything, meaning they're, yes. But it's people can laugh and think it's silly, but again, we talk about it in frequencies and color. We haven't done really much on color therapy. We have to do
we can do an episode on that.
Yeah. But like, for instance, I was doing a lecture and I had this mom who was a therapist and has been taking my course. And primarily, like a lot of doctors and therapists do, because they have a child with issues. And so she lived in Florida and her husband was with her daughter. And we were talking about the real science between color and how it influences the brain and the right brain and the left brain. And so, her child clearly had more of a right brain delay. And so what we know that blue, green, violet, purple more activate the right brain, and red, orange, yellow is more left. So she listened to it and she called her husband up and she said, our daughter's favorite color was like red and yellow. And she said, get all the red and yellow out of her room and switch it with blue and as much as you can. And she did that. Her husband called her the next day and said, I don't know if this is coincidental, but I just had like the best day ever with our daughter. And could it be that we changed the colors in her room? It
could be.
So again, this is real stuff.
That's why we use red lenses all the time. It's not why my dad wears blue all the time. He wears blue all the time because it makes his eyes pop, and he knows that. But also, it does stimulate your right brain, even though he doesn't want to have to stimulate his right brain because he wants to be one of us. But
and as your mother says, you're not right brain.
Yeah.
But you're wrong, honey.
You can be whatever you want to be while you're in Tennessee.
It's hard to know.
Oh, okay. Yeah, he's a Libra. He's balanced. Oh, also, I just want to talk about the brain driver real quick. This is also something. Yes, we use color therapy to stimulate our brains. I don't know why I'm saying we. I'm not a doctor. I'm not stimulating anybody else.
Pop star, not a doctor.
I use color therapy to stimulate my own brain. He does it to stimulate all of his patients, whatever. But also a brain driver. The brain driver is a transcranial stimulation device. It's very hard for me to say that. But I've been using this, as I told you guys, and I'm also 68 days no alcohol. So doing the eye lights, the brain driver, not drinking, bettering myself for you people. I hope you appreciate it. But yeah, this will stimulate. You put the red side on the side that you would like to stimulate, which would be my left side. And you put the black wire side on the side that you would like to kind of just keep chill, which would be my right side, because that's the side that's always freaking out for me. And you just sit with it, watch your favorite show. I'm rewatching Harry Potter right now. It's pretty fire. And that's that.
Well, a lot of this is being stimulated because naturally a lot of people are listening and they're getting what we're saying, and they're getting the message that you can change this and that you can have control over your own feelings, your own life, your own destiny. and you can understand your own brain, and you can learn how to change your own brain. Ultimately, I think everybody should be their own doctor. You should have that level of awareness of your own. I mean, you go to a doctor when you need it, but honestly, the best thing you can do is really be aware of your own brain or your own child's brain and be an expert in your own brain. And most people don't know anything about their own brain. And so we're trying to bring that information, but then the next thing is, okay, what do I do? How do I do it? That's why I wrote my books. But what we want to bring to you are real tools that we use, that I use every day in my offices, that I use at home myself, that you're using. And we're going to put together a whole brain box that is going to be like a brain balance kit that you're going to get to be able to, use at home in a safe, cost-effective way. And so this is where we're going to start to highlight the different tools that we're going to put in this box and how they work individually so that you can, really start making a difference. And, it's always best to lead by example. And we've talked about how the brain, we've talked about, a lot of the issues that you've had and sometimes still continue to have, and how the brain is very dynamic and you have to stay vigilant to try to keep it balanced.
Yeah.
And that there's no such thing as fixing it permanently, that you can get it into an optimal state, but to keep it there, it can easily get out of balance, especially if you're really gifted or talented in using it, like doing right brain stuff all day, every day, like what you do with music. And so you have to be able to say, what do I do to maintain it? How do I get myself back into balance when I get myself out of balance? And that it's a very dynamic, and that's one of the advantages of the brain. That's also the biggest vulnerability. And once you understand that you can control that and you can do that, and you can do it without medication, which doesn't do that, that's what we're trying to bring.
Yeah. Okay. Well, speaking of, actually, I don't really know because I don't know too much about this, but all I know is that pretty girls have vertigo because all of my pretty friends have vertigo. And they make me call my dad and ask him to help them with their vertigo. So I don't think I've ever really dealt with that. I do get like dizzy spells, but that just might be a me issue. But yeah, we were going to dive into talking about that because this man knows a lot about it.
So your friends are dizzy blondes, right?
Oh my God, you're not allowed to say that.
I know that, but where did that thing come from? Why pretty girls? No, but that's not. So
it is all my blonde friends actually that happen to have vertigo.
There's a correlation
No.
between dizziness. Well, first of all, right off the bat, you said, I don't think I've had vertigo, but I've been dizzy. Okay. What's the difference? So let's dive into the word dizzy. Because right off the bat, like if somebody comes to me as a patient, they say, I'm struggling with dizziness. Right off the bat, I go, okay, so there's different ways people may describe dizziness. One is vertigo, especially, is where you really feel like you're moving or the world is moving, like spinning or moving in some way, right? There's like the world is moving or you're moving in the world. And typically, it's a spinning sensation, right? Either around you, where the world is spinning around you, or you're flying around the world or the room, or it could be like over, like maybe you feel like you're falling forward or top, but there's spinning. That's really more classic vertigo. Then there's where people will feel just kind of wobbly, like they're walking on a boat. Where they just feel like they don't feel kind of more balanced or they feel off balance. And then there's where you feel lightheaded, like you're going to pass out. And people describe that as dizzy, but it's very different. That happens
to me sometimes.
Right. So when you're talking about that you were dizzy, you mean like lightheadedness, right? Yeah. So lightheadedness is usually caused by low blood sugar or, if you activate your vagal system too much, you're parasympathetic, like if something is really disgusting or you're worried, or like people, when your blood pressure drops, that can cause you to feel really nauseous. Anything that also can lead to nausea is also usually what causes lightheadedness. Now, all those things can happen together. You can get, I've never experienced this, but like people who may get the bed spins from like too much alcohol, right? You've never had that
Oh,
either, right?
never.
No. So that's where you may feel wobbly and ataxic. You may feel like when you lay down, the world is spinning.
Yeah, that's the worst feeling
And then
ever.
you feel
So I've heard.
lightheaded and may break out in a cold sweat and feel like you're going to throw up. So they can be interactive. But the most common or most difficult is like the true vertigo, where people literally feel like the world is spinning or they're spinning around the world. And it can be really, really terrible. And you really can't function if you have it full blown. And so, but we can talk about all those situations. But like recently, one of your friends who happens to be blonde,
Paigey,
was struggling with vertigo. Like she was literally feeling like the world was spinning.
Yeah. So how does that happen?
Well, in our inner ear, so there's a system really that helps us stay balanced. And it starts with, when a baby's starting to crawl through the world and their postural, so the spine is kind of like the foundation of our balance system, as you would expect, right? It's kind of like the spine and there's two sides of the spine. So they need to be balanced between that. And as a baby starts to move on the ground, the spine, they start on their belly and the spine is what moves them. And so to get them to be balanced, and then, especially the neck, because obviously lifting the head and turning it, there's a tremendous amount of receptors in our muscles along our spine, especially in our neck, that send signals to our brain about where we are, where our body is in space. And then our inner ear, which also has two sides, has what we call our vestibular system, which is really certain receptors in the inner ear and fluid that will be activated when we turn one side of the other. And that, again, also gives us a sense of gravity and a sense of where we are, right? So with our postural muscles, we stand up and we need to be balanced. And then our inner ear also, now we put that in position, and our neck in a position to really be sensitive. And that needs to be balanced, and it's sensing gravity. And then that is an influence on our eyes and where our eyes are moving and how our eyes are balanced. And then those three systems come together to build these maps in our brain, especially in our right brain, about where we are, where our body is, and where our body is in space at any given time, so that we know how to move our body in the most effective way, and that we're not, miscalculating. You're trying to run away from a predator and you think the predator is coming from your left and it's really coming from your right. And instead of running away from the predator, you run right into him. Doesn't really work really well, right?
No.
So that system is really intricate and it's always working and we don't even realize it. Like when you walk, any animal walks, our head bobs up and down. It does a figure eight, right? It does this sinusoidal type of movement. Now, when you're walking, you don't feel like your head is bopping up and down, right?
No.
No, you feel like the world is steady as you're walking through it. And you feel like the world is flat and balanced and all of
Sorry,
that.
I had to test it out. But I don't walk like that. Unless I'm like really like feeling myself.
No, but you do, but you don't know it's happening, right? Whether you know it or not, your head is bopping up and down. And so if our eyes were just fixed in our head and our eyes would be moving with our head, then the world would look constantly blurry because our eyes would be moving all the time.
All these movements are making me all.
There you go. There you go. So this is the basis of motion sickness, by the way.
This is making me feel motion sickness.
Just thinking about it.
Yes.
Right. Yeah.
I don't feel good.
So, that's good that you're experiencing. We try to bring your experiences to the audience. So, if you have motion sickness during it, just like some of the other episodes. So we have a mechanism, especially in our neck and our inner ear and our eyes, that as our head moves, it activates our neck, our inner ear, and our eye muscles. And our eyes are driven in the exact opposite direction and the same exact speed as our head is moving. And so effectively, it keeps our eyes still to the world while our head is moving, which means that our eyes are always constantly moving to compensate. And that makes us feel balanced and steady And if that system is off or out of balance, it leads us to have like head tilts or body tilts, or our eyes can be like a lazy eye or up or down.
I feel personally attacked.
But it also, if it's really out of balance, can lead to vertigo and spinning and dizziness, because what's happening is in our brain, because of this imbalance, it feels like we're moving one way really fast and it's trying to get our eyes to move in the other way. And that's why there's something called nystagmus, where your eyes will jump like that. And that's what makes you feel dizzy. And depending on the direction of the movement, you feel like you're spinning right, you're spinning left, you're spinning up or down. And that is the foundation of vertigo.
If you guys are watching this, then I can't really exaggerate for you. But if you're not watching this, my dad has his hand as close as he possibly can to my face and is shaking it in all of the places and all over. And I'm going to throw up everywhere.
It's
and
not
he will not
close
stop
as
doing it.
Can. See, this is it. Your judgment of spatial perception is off.
Oh my God. I got side bangs when I was like 13 to try and like cover up my unibrow and my palate expander and braces. And I took a picture and was smiling, and and my hair was to the side, and my dad told me that I was like throwing off my entire brain because I was holding my head to the side for my side bangs.
And the facial asymmetry, you forgot.
Oh, yeah, I had a lazy eye. That was not cute.
No, your facial asymmetry.
Oh, yeah. My face was off. The picture that I am painting for you guys right now.
I always say that, if you tilt to the left, you have more of a left brain imbalance. If you tilt to the right, you have more of a right brain. And that doesn't work all the time. But there you are in your, like, I don't know.
Prime. I'm just kidding.
Sophomore picture or something. And you're like this. And your head's all the way tilted to the left. Your face is asymmetric. You look beautiful, by the way.
No, I didn't.
Yeah, you did.
Don't lie.
Listen.
You're telling everyone my face was asymmetrical with a lazy eye and a head tilt. It was not beautiful. And the unibrow and a palate.
Anybody that knows you knows how beautiful you are. Mm-hmm. You get that obviously from your mother, not me. And, but
okay,
it also highlighted your gifts.
Highlighted my gifts. Yeah, so anyway, I don't know if the motion sickness has to do with vertigo, but anyway, I'm getting off topic and making this about myself.
It does have something to do with it. It's a little bit different than vertigo because you didn't have spinning. It's more this another part of the system of the inner ear is what make you feel wobbly, like you're walking on a boat. Have you ever been on a boat and got seasickness?
Yes.
Okay, so that's the same thing as driving in a car and getting motion sickness. So why do people get seasickness when on a boat? Because it naturally disrupts this other part of your system that doesn't make you feel like you're spinning, but it makes you feel like you're unsteady, and that affects your eyes and your eye level and the world. And that also can happen in a car, and that's what happened to you as a kid. And still, if you're not diligent, can happen now.
Yeah, it does.
Like if I'm waving my hand in front of
your face. This is really
But it's interesting because we talk about right brain creative people, and we talk about how like chefs, or many of them are very right brain dominant, creative, artistic, right? And so there's this show that Guy Fieri does, and we love Guy Fieri. He's pretty cool.
My mom refuses to say his name in like an American way. She's like, it's Fieri.
Well, she speaks Italian really well. So he has this show called Tournament of Champions, which is a pretty cool competition show. And on it, he has what's called a randomizer, which is where there's like 6 different things, and he spins it down so that it spins. And it's funny because most of the chefs will go, I can't look at it when that's happening. It makes me feel dizzy and sick. Or,
yeah, that happens to me.
And I think right off the bat, I'm like, they're a right brain dominant person, and they're hypersensitive to that, and they're just showing it by that. You know?
So are right brain dominant people more susceptible to
motion sickness
and vertigo, or that can happen to anybody?
Nope, they're more sensitive. So now, okay, so if you go to somebody, and again, one of my best friends in my profession is a guy who's a PhD in vestibular rehab. So I know this stuff really well.
What's his name?
Dr. Carlo Ronaldo. He's actually doing a center with us in Sydney, Australia. He's brilliant. He's great. We just did a lecture together. So, this is something when we talk about, so like with Paige, like basically she said, what was the first thing she did? When she got vertigo or felt dizzy, actual spinning, she went to somebody who tried to do a repositioning activity, meaning that she was told that there are these calcium crystals that are in your inner ear, and if it comes out of the hole and activates, it can activate the system of your inner ear and make you feel very dizzy and lead to vertigo. And that is true. It's called benign positional vertigo. And there is a maneuver called the Epley maneuver, which will move the head in a certain way to try to reposition the crystal back into the canal. And in people that have that, especially putting their head to the back, makes them feel really dizzy. And so when they like lay down in a bed or something, and that can work, and that's great. But that's only one cause of that. And also people who have neck problems or who have fixations in their neck, that can cause it. And I think it happens much more because of that, because it affects the same basic system. Or, people, if they have too much fluid in one ear versus the other, if people have ear infections, there are many things that can affect it, but imbalances in the postural muscle and head tilts and eye tilts and the imbalances in the brain and brainstem are probably the more primary reason for it. And so that Epley maneuver won't work with that. So many people I've seen, they've had vertigo. They do that because, the traditional doctor and therapist, that's all they know. And they think, okay, that's the answer to every vertigo. It's not. And so they'll do it and it doesn't work and they don't feel better. And they'll tell them, well, it'll take a few months. No, it should happen right away if you did it right. And so,
oh, really?
Yeah. I mean, if you do the procedure right and it's the cause, it's almost like an instant you feel better.
So sometimes it is the cause.
Yeah, absolutely. Absolutely. That is the cause sometimes. I don't know the exact percentage, but, it's not anywhere. It's probably not even 50%. It's probably much less than that. So sometimes the answer is you need to get your neck adjusted. And we talked about that, and we talked about chiropractic and how important that is, especially if it's as a result of like a car accident or an injury to your neck or something. Sometimes it's because you have this imbalance in your nervous system that has tilted you one way, and now, something's thrown it over. It could be because of an ear infection. It could be because of too much fluid in an ear, but it's always because of an imbalance in the system. It's always, whenever there's vertigo, and it can be one way or the other. People will say, and that's one of the first questions I ask people is, they say, I'm dizzy. And I say, well, tell me which type of dizzy. And if they say, well, there's spinning involved. And I say, okay, you spinning or the world spinning? And they may say, well, the world is spinning around me. And then the next question I ask is, which direction? Now, they may not know it off the bat, but many people will then stop and think, and they may say, well, the world is spinning to the right and I'm spinning to the left. So if the world is spinning to the right, it's almost always that their right inner ear is overactive, which means their left inner ear is deficient and or their left side of their neck is fixed. Okay, you got it?
Yeah, I literally am going to throw up everywhere after this episode. I've never been so nauseous, but yeah, I got it.
And so the answer is what's the answer? Most people will say, okay, again, they may give you something like Dramamine or some drug to dampen your perception of that feeling dizzy or for motion sickness. But the real answer is you have to pick up the side that's underactive. The side that's making you feel dizzy isn't the actual problem. It's the side that is too low. That is the problem.
And it doesn't matter what side it is? Like it can happen on either side?
It can happen on either side. Now, so these signals come from our inner ear, from our spine and our posture, and from our eyes and our eye muscles, and they go into the brainstem, and they go to what's called the vestibular nuclei. And so that sends signals down to the spine, so you have good, proper balance and tone. And you don't have a head tilt or a body tilt. It goes into from the inner ear, that also helps to make sure that your head is straight. And then it goes into your eyes and make sure that your eyes are aligned, so you don't have a lazy eye or one eye is an up or down, and that you can move your eyes in a balanced way. And then that information goes up, especially into the right brain, and uses you to build a map of your body, so that you start to literally build a 3D map, so you know where your body is. And then that's used to build a map to move your body. But that area that it goes to is the primary area in the right side for all of that inner ear input. So even though we have what's called the parietal insula vestibular cortex, the primary area is in the right. It's on the right and left, but then the final processing of it is primarily in the right. And that's where it first comes. So if you have an overactive right brain, then you may be more sensitive to getting dizzy or getting motion sickness, and you may be sensitive to feeling nauseous or fainting. And that's what POTS is, essentially. When people have POTS, we talked a little bit about that, right? Postural orthostatic.
And you said POTS is something that is more something that people that are right-brained deal with as well.
Right.
Okay. Yeah.
And it's so, just the fact that you're sitting here as I'm talking about this, you're getting nauseous, and I see it in your face.
Yeah, my mouth is like watering.
Yeah. So
I gotta throw up.
You are more sensitive even to the imagery of this because you're so right brain dominant, and just even talking about it. And this is also like, I remember when I was in grammar school, I always liked science and everything, and I never knew this about myself, but so we were in science class, and I love science class, but we were talking about something about blood. And we were talking about blood and bleeding and whatever. And all of a sudden I started feeling really lightheaded, and I passed out. And they thought I had a seizure. I was in like 5th grade or something, and I had to go to the doctor and get an EEG and all of that. And they never knew. They were like, why did you pass out in the middle of this, seemingly healthy kid? All of a sudden, in the middle of the class, you boom. And I mean, I was out, unconscious. And I never told anybody because I was embarrassed. This is, again, me as a right.
I literally was biting my tongue. I was like, before you even started this story, I was like, my dad is about to try to low-key flex that he's a right brain person, and he is not. He's like, he's like, oh, you're dealing with that? I can totally relate to that. I passed out one time because I'm so sympathetic.
You and your mother are so annoying. You're so freaking annoying. So anyway, I passed out because just the thought of blood made me feel nauseous and lightheaded, and my parasympathetic nervous system kicked in, and my blood pressure dropped, and that's what made me pass out. And I didn't tell anybody that because I didn't want to be embarrassed, because I'd seem like I was like a wimp, like you passed out at the thought of blood, like what a baby thing to do. Yeah. So anyway, but that's an example of it.
That is.
Did you ever feel like that about blood? But you feel like that just talking about it. I feel that way
about blood. Yeah, I'm going to go to the hospital after this episode. Stop bringing up other phobias of
Don't
mine.
pass out.
No, when I can't stop it. I can't touch the inside of my elbows, because that's what makes me think about the needles, and then I go, ah!
Your mother is just like that. Your mother freaks out over, any sort of IV or anything. Like, she can't watch it on TV at all. Oh She's always like, close your eyes. She's like, when is it over? When's it over?
Oh, I can't even think about it. Okay. Back to Vertigo.
Yes.
My friend Paige came over to get adjusted by you.
Right.
For her vertigo, because she thought it was the crystals.
Right.
It wasn't the crystals.
No.
You adjusted her. You also told her, which was really important, and my friend Ashton that dealt with this, another blonde, that they can't get up on a certain side of their bed every morning or something.
Well, this is why you have it. So with Paige is a perfect example. So she had vertigo. She went to a doctor. They said, oh, it's this crystal thing. And so they sent her to somebody to do it. They did it. Didn't really help. I think she said a few weeks later it felt a little bit reduced, but then it came right back. She went again and it wasn't doing anything. And she had that done a few times and it didn't really affect her. So for me, you look at it and you say, you do triage, right? Okay. Could it be the crystal thing? Yeah. How do we know? Well, if you do the repositioning right, it should be fixed. If it's not fixed after a few times of doing that, either you're not doing it right or it's not the problem. What else could be the problem? Do you have an infection in your ear? No. Do you have any, fluid in the ear? You look in the ear, you see, no, it's not that. All right, well, what else? Do you have any neck stiffness or pain? Yes, she did. She said, my neck is stiff all the time. So then I felt her neck, and she definitely had restricted movement on the side. That would be the lower side, because she said which way she saw the world spinning. So I knew which side was overactive and which side was underactive.
My dad started out as a chiropractor. If you guys didn't listen to our chiropractic episode, I'm just throwing that out there if you're new to this episode.
And so if it's her neck causing this, then I adjusted her neck. Well, first I did was I lifted up on her head to see if that relieved some of the vertigo, and it did. So we know that the neck had something to do with it. Then I adjusted her neck on one side to address the imbalance, and she felt a lot better right away. So, and then she felt better after that. And we know, okay, then that was the primary problem. And again, it's not always the problem, but it could be the problem. And there could be other things. I mean, you could have a brain tumor in one side of the brain that could make you feel dizzy, or an acoustic neuroma or tumor on your acoustic nerve in your ear, or you could have, it's called Meniere's disease, where you have this buildup of fluid that's more, maybe you have a genetic issue with the drainage of the fluid in your ear. So there's a lot of reasons, an infection. But the bottom line is the majority of it is probably either a crystal thing, or that you have a problem with your neck, and or that you have this developmental imbalance in your brain from the very beginning, where you have a head tilt and a body tilt and your eyes, a lazy eye, things like that.
Okay, well, good news. I now have every single thing you just
But you
named.
haven't had vertigo.
No, but I've been in a phase of convincing myself I have certain things going on with me.
Yeah.
And you just said there are all those things that you could have. And I thought I had a brain-eating parasite this weekend. So
Yes, which is, crazy, right? That you think you have.
If
you had a brain-eating parasite, you wouldn't be here right now. You wouldn't be able to talk.
Dad?
You would be in a coma. You'd be fever. I mean, you'd be in bad shape.
Oh, I'm not feeling very well right now, am I?
I'm
feeling a little sweaty.
Walking around functioning at any level with a brain parasite actively in their brain.
Special.
Okay, so. And who'd you say Brandy Glanville had a parasite in her face or something?
Yes, from the Real Housewives. She has a parasite eating her face.
You actually believe that?
She talks about it all the time. I can't avoid it on my social media. I'd like to stop seeing it, honestly, because it's not good to look at.
Well, there's a lot of things that can make you feel nauseous. Like, for instance, one of the things I think that it's a big right brain thing, and we've talked about it a little bit, and we were laughing about it yesterday because this is funny. It's really kind of funny, but how you have this constant sense of being like you're going to be in trouble.
Oh, yeah. Yeah.
Like the time we talked about you're with the boxes and you felt like you were going to get so much trouble because you.
Yeah, I have all the boxes. I had all the boxes in my apartment, like I told you guys. And my dad came to my apartment and he was like, why? What is this? And I was just like, well, I'm just afraid I'll get in trouble. But I told you guys that story on a recent episode because I was actually afraid that I would get in trouble for putting the boxes somewhere that they shouldn't be, and then I would get kicked out of the apartment. Anyway, we figured out where the boxes go. I still live there, but took me a while to go into my gym because I thought maybe I'd go in there and I would do something to upset somebody. Or I would start lifting weight and they'd say, what are you doing?
Right. Yeah. Like, that cracked me up. Like your biggest fear is someone's going to come up to you and go, what are you doing?
Yes, that is literally my biggest fear. Oh my God.
And like, what are you doing? And you're going to be like, am I in trouble? And so neuroscience wise, this is your guilt network. You have this guilt network in the right side of your brain that is just crazy high. And I guess you've had it your whole life, right? Because you've always been like concerned about getting in trouble.
Terrified that I'm going to get in trouble, yeah.
Yeah, that's that feeling of guilt when you shouldn't be guilt. You didn't do anything wrong. I mean, you as a little girl were, like you never did anything wrong because you're always so afraid of being guilty and you didn't really lie. That's why you and my snitch, like your brothers did a lot of wrong things. And I would always, of course they would lie in a second. And I'd say, did you do that? No, I didn't do that. Ty, did he do it? No. Ty would, and then I'd look at Ellie and she'd be like, Ellie, did they do it? And she'd be like, And I'm like, all right.
And that's how I learned snitches
I know,
get
because
stitches.
Ellie could not lie. Ellis could not lie. But that was because of that guilt network. Little did I know that it also has a double-edged sword that you constantly are feeling like you're going to get kicked out of things or whatever.
Seriously though, like, because, I went on vacation to Hawaii with somebody I was dating last year. And we went to the island of Molokai, which is like this very small island. And he was hunting all day. This is a very odd story, but that's the truth. And he gave me a car. He was like, take this car, go around the island, go do whatever you want, like while I'm hunting or whatever. And I could not leave the house. I was like, I can't go around on this small island. I'm going to get in trouble. Like that is literally what my thought process was. I was like, this is a small island. First of all, he's like, go to that nice coffee shop, whatever. I was like, I'm going to go into the coffee shop. Everyone's going to be like, what are you doing here?
What are you doing?
And I literally did not, the entire time I didn't leave the house. It was a nice house, so it was fine. But I was like, I can't. He was like, did you go look around? I was like, no, I didn't look around. Like, I thought like everyone on the island was going to be like, we are locals. Why are you here? And so I just didn't leave the house.
And did you feel nauseous or dizzy or lightheaded?
Yeah, probably. I mean, I feel a little nauseous talking about it.
That's how I'm tying this story all into what we're doing right now. Okay, I'm tying it into the vertigo issue. Like, people are probably sitting there going, "What the hell?"
I know. Sorry, we get a little ADD
not
on this
driving
episode.
around Hawaii. I just brought it back. See that?
Thank you.
It was from the
and
very
that's
beginning.
your left brain that did that for us. And that's why we're here, to balance as balanced brains.
No, I'm going to pass out any second.
That's fake.
To prove it to
Faker.
you. I'm a poser. I'm a right brain poser. All right. So, but the idea is that, vertigo is a real thing, but it is different than lightheadedness, which lightheaded may be because you may have some metabolic issue. Your blood sugar is low. You have low blood pressure. When you stand up, if you get lightheaded, like you're going to pass out, that may be because, again, overactive right brain or because of an imbalance in your inner ear or in the part of your inner ear that also leads to motion sickness rather than spinning vertigo. And then there may also be where you feel like, out of balance. So that's where we're talking about this spinning, which is vertigo, which is where your eyes are jumping. That's called nystagmus. And I won't keep doing that because it's making you sick. There's the balance part where you feel like you're wobbly or you feel like you're out of balance and you're going to fall. And then there's the lightheadedness kind where you feel like, all of a sudden you're going to pass out. You may break out in a cold sweat or something. And all of them can be associated with nausea. And you can have all three of those at once. And, they're all partly because you have an imbalance. Like you have to feel an imbalance in that system. And a lot of it that most people don't know, and maybe the most common, is a problem with your neck. If you have a problem with your neck, and that can cause, just like problems with your neck are the most common reason for headaches as well. And often headaches go along with that as well.
Wait, but why can't you get out of bed on a certain side?
Well, because what I was telling them, when she actively had this, if we want to, a lot of people say is what triggers this for them is they turn over in bed. And then all of a sudden they start feeling really dizzy, or they're going to get up out of bed, and then it triggers this. So why would that do that? Well, if the crystal is when you're turning, you could knock that crystal out, and that might cause the vertigo. But also, if you have one side that's more active than the other, if you turn towards that side, you're going to trigger the dizziness. Even turning your head or moving your eyes in one direction. And that's why, one of the first things I do is I have people, look at my finger and turn their head one way or turn their head the other way and hold it. Or I may move it one way or the other and see if it triggers it. If one way triggers it and the other way makes it worse. And so with that, if turning to the right, let's say, turning their head to the right makes them feel more dizzy and turning to the left takes the dizziness away, then I tell them that you don't want to turn to the right getting out of bed. You want to sleep on your left side so that you're activating that, not your right. And then when you get out of bed, turn to your left. And then when you get up, stand up. And then instead of turning immediately to the right, let's say to go out of the room, turn left and make a circle and then walk out of the room. And what you're doing is you're just trying to not activate that one side. So you're trying to activate more the side that's underactive.
Like Zoolander, where he's like, I can't turn left.
There you go, see?
And he keeps turning left while he's saying it. He's like, I can't turn left. And she's like, that's what you're doing.
Maybe that's related to that. Yes,
Yeah.
I use that Zoolander as that example.
And Zoolander had vertigo. He was just misunderstood.
Yes. Or, just spatial issues. And, a lot of that is related to it. A lot of people have problems with really spatial direction. And, that's part of that. But so it is a real big thing. So if you're out there and you struggle from dizziness, first determine, is it spinning? Is the world spinning around me or am I spinning around the world? If that is happening, or is it spinning in one direction more than the other, try to think about, okay, is the world or spinning to the right? So if I'm spinning to the left, the world is going right. Or if I feel like I'm stable and the world is spinning right, either way, if I'm spinning left or if the world is spinning right, the world is spinning right, right? So that means that the right inner ear and probably the right side of the neck is overactive. And turning that way is probably going to make things worse. Turning to the left may make things better. And if that's the case, then there's definitely this imbalance there. Now, it could be because of this crystal thing. So you can go to see somebody and you can have them try the repositioning. And if it works, it should work pretty quickly, almost immediately. And if it doesn't work, then it's not that. Mm-hmm. Now, understand that most doctors and therapists don't understand that if it's not that, they're like, all right, I don't know what else could be. Well, it could be an ear infection. That's pretty easy to figure out. It could be because there's more fluid in your ear. It could be something called Meniere's disease. You can kind of figure that out pretty easily by measuring the pressure in the inner ear. It could be because of a tumor on, one of your acoustic nerves, but an MRI will show that. But most commonly, it's going to be a problem in the neck or an imbalance that is affecting your neck and your inner ear and your eyes, which may be part of a bigger neurological imbalance. And if you are more right brain dominant, you're more sensitive to, any type of vertigo or motion sickness. But again, that's one system when you get spinning. If you feel like wobbly, like you're walking on a boat, or you feel just like real unsteady, and, along with that, you might feel, a little like, not good, maybe nauseous. That is another part of your inner ear called the otoliths. And that is also an imbalance in there, and it works in a similar way. but takes a little bit different therapy to correct that, but also could be related to a neck problem or a body problem. Or you could feel lightheaded, like you're going to pass out. And that could be because of a number of things. You could be hyperventilating. If you're hyperventilating, you're numb, your lips and your fingers may go numb. So if you feel any numbness in that's more of a hyperventilation.
That's happened to me before.
And it could be because of low blood sugar, because you're not eating and you're starving yourself too much. And then, as soon as you eat, if the lightheadedness goes away, then it's probably a blood sugar problem. It could be a blood pressure where your blood pressure is too low. And the most common reason for that is a right brain dominance where, over parasympathetic, over vagal activation. It could also be, again, because of that situation. So those are the most common things to think of when you have it. And, either way, it's almost always related to some sort of imbalance if you're feeling those symptoms. And so ultimately you have to look at the balance of the brain and the nervous system especially.
So if someone is currently suffering from vertigo and they are listening to this episode, what would you suggest they go do?
Well, if they're listening to me, first of all, which one of those three types are you feeling? If you're feeling like vertigo where things are spinning, and if you can, figure it out and you say, okay, I feel like the world is moving to my right, then I would say, look at something straight ahead of you, turn your head slowly to the left all the way, and keep your head in that position and see if it makes your symptoms subside. Turn to the right and see if it makes your symptoms worse. And if it does, there's definitely this imbalance in your inner ear, and it could be this crystal thing, or it could be something else, or it could be a neck issue. And so I would say you can go to a doctor who may be aware of that. They can try this Epley maneuver. If it helps, great. If not, go to a chiropractor, have them adjust your neck only on one side. And if that helps, great. You might need to do some rehab afterwards to stabilize your neck and do some exercises. If it's an otolith problem, then that's a little bit more complicated. You got to go to somebody who really understands the vestibular system and otoliths. But same thing. It could be a neck issue, it could be an inner ear issue, but you feel different. You feel like this wobbly stuff. And the other difference is your head tilts in a different way, right? Most people that have the spinning inner ear type, their head tips to the side of their brain deficit. But if an otolith problem,
I'm literally been talking to you with my head tilted to the left.
You may tilt the other way. So, this is where we look at it. Do you have a facial asymmetry on the same? Do you have a facial weakness on the same side as your head tilt? Or do you have a facial weakness on the opposite side of your head tilt? That may tell you the difference as to whether it's an otolith or a more semicircular canal problem. And then one of the things that's really effective with otoliths is, that bone conduction, the vibrating.
Oh, the headphones, yeah.
Right, vibrating the inner ear or vibrating the mastoid, this little bump behind your ear. Like vibrating the side that's underactive actually helps to balance that out. So and different frequencies work. So that's why we gave you, because of the motion sickness and the otolith problem that you have, where your eyes are also not even, weren't. Then we use the bone conduction on one side to activate one side and dampen the other. And that can be a really effective treatment for that. If you have lightheadedness, then you have to look at what you're eating. You have to look at your blood sugar. Do you have any, diabetes or anything like that? Are you anemic? Are you hyperventilating? Is there some other metabolic type of issue going on that, cardiovascular problem? Obviously, do you have a heart problem? And that can cause it. Pacemaker problem, So, that's kind of how but the vast majority of people that have some sort of vertigo or motion sickness, it's going to be an imbalance in the inner ear that's a functional imbalance, meaning that there's nothing wrong. There's no tumor in your brain. There's no, gross abnormality in the inner ear. It's a developmental imbalance in the nervous system. And all the things that we've been talking about is ultimately the best treatment for it.
Okay. And so if someone like me who the world is always spinning around. I'm just kidding. That was a joke about you saying if you should check if the world is spinning around you. Do you get it?
You moving your own finger. Does that make you feel dizzy?
Yeah, I feel absolutely awful. I'm just going to say this whole episode I felt awful.
Don't pass out.
I'm going to. But no, someone like me who I guess I don't really struggle with vertigo, but I often obviously struggle with motion sickness.
Well, let's talk about even practically motion sickness. So, do you sit on a particular side of the car to get less sick?
Yeah.
Okay. Why do you think that is?
So I don't get sick.
Right, well, but if you sit on one side, which side activates you? Which side makes you worse? Well, this would need you to be able to understand right from left, which you don't understand.
Oh my God, shots are being fired today. I today in the car was sitting on the left side, which I do to be nice to you. I sit behind the driver so that you can have more room for your legs. And
even though your legs are probably the same length as mine because your mother's are, so yeah.
But I'm just kind. No, I sat on the left side and normally look out the left window. I think when I get nauseous, you could not stop talking about Miami Vice, so I kept staring at you on my right side, and that made me feel really nauseous. Right?
Yeah.
Is that correct?
That is correct. You got the right and left correct.
Oh, wow.
Very good. See, the treatment's working. Less alcohol can help with that. So if you have motion sickness, does sitting on one side of the car or looking at one side of the window actually help and the other side make worse? If you do, then you're diagnosing your own imbalance there. Mm-hmm. Okay? And there's also something called the optokinetic system, which is your eyes, and when your eyes jump. And so that's another thing that when you're looking out, your eyes are, jumping because visually you're seeing things go by you. And that can also activate the system. And that's even more with, an otolith problem, or what you have is the optokinetic system where, that thing where we have people look at stripes.
Yes.
And have you
My dad had me download an app. I remember, I think I got really embarrassed in college. I was like looking at my phone. My dad had an app called Optodrum that he had me download. And it's literally just black and white stripes going across your phone. And I was just sitting, I think I was sitting in the corner one day just staring at my phone, and I was just watching stripes go by, and everyone was like, what the hell are you doing?
But you did it because it made you feel better, right?
Yeah.
So that's the thing.
It depended on which way they were going, though. If I had it the wrong way, I was like so sick.
Exactly. So there's an eye component system, but it's all built on that same system, right? The spine, the neck, the inner ear, and the eyes. They're both paired systems. So is your area called your cerebellum, and so is your brain and your cortex. And those systems are important. And they're the most important as you're developing and as we're moving through the world. And that's another reason why rolling over, some kids, if from the very beginning, they only rolled over to one side. Right off the bat, there's a little bit of an imbalance in that system. Or if kids have a little bit of a neck injury from the beginning and they have a restrictor, they have something called a torticollis where they can't turn their head to one side. Babies, infants have that often. Or if you have your child has a lazy eye, or you had a lazy eye, that system is imbalanced. If you develop a scoliosis, that system is imbalanced. If as a baby,
scoliosis is developed from having an imbalance.
One part of it, yes, can be caused by an imbalance in the system as you're developing. But then, like, we have kids, like when we go through their crawling, that they used to drag one leg, and they would only drag one side of their body from the very beginning. And the pediatricians go, oh, it doesn't matter. It's okay. It's not a big deal. It is a big deal. And what does it mean? It means that your system is already imbalanced from the very beginning, and that this is going to accentuate an imbalance and can lead to all different types of issues that are related to an imbalance, like vertigo, motion sickness, and all the mental health issues that we talked about, or scoliosis, or back pain, neck pain, chronic, all of those things, a lot of those things, and they can start really early on like that.
Okay. Okay, so I know this episode's been a little ADD. I think that's my fault. Or ADA, whatever. It's been a little hyperactive on my end.
Well, listen, a lot of the people out there, like Marianne, who recently, hi Marianne, if you're listening.
Hi Marianne.
She talked about how funny you are and how that's like her favorite part. So I think you were really funny this episode.
Oh, that's so nice.
Yeah,
okay.
So I think the more nauseous you feel, the funnier you get, actually. So I'm going to wave my hand in front of your eyes.
No, it's actually crazy what you've been doing. And I now have a lazy eye. I have scoliosis. I have a neuroma. I have torticollis. I don't know what else you said, but I literally have to go to the emergency room after we finish this up because All
right, so this leads to another topic for our show that we need to do, which is being a hypochondriac.
Oh, okay, good. Look at that. I hope that I helped you guys with your vertigo by me taking on now 7 different illnesses.
Right.
But that's...
Well, that's because right brain dominance people are empaths. So you take on the pain or the difficulty or this, but you literally feel it.
Pisces are also empaths. You hear that, Jack? I'm a Pisces.
So that comes from empathy. And empathy is a right brain characteristic. It comes from the right insula. And people that have bigger right insula, and the insula is also the same area that we talked about, the parietal insula, that is the primary area for the vestibular system. And that's the area that can also have you have too much motion sickness, but it also makes you overly empathetic. And the definition of empathy is where you literally take on the perspective and the feelings of the other person. Sympathy is where you can sympathize. I feel bad for you, right? I can appreciate that. And that's more like a left brain thing, right? It's a detached thing. I'm not saying that I feel your pain. I'm not saying I feel you're nauseous, but I can.
Well, you wouldn't because you're left brain, but
I can feel bad for you.
Well,
but empathy. So empaths are overly empathetic, which means that they feel everything that the other person feels, and even just imagining it, you literally feel those symptoms, and that's kind of related to being a hypochondriac. So we can go through that.
Okay, well, fine. This brings it all full circle. Like I said, pretty smart, empathetic girls have vertigo. And that we just proved it. Your vestibular system is a little much.
Okay.
Right?
Yeah, I can't say that. You're a girl. You can say
I can say
you can say things.
I said it.
And you when you were younger, you were definitely almost a blonde. So,
Yeah.
And you're a girl, right? I can't say that I'm not blonde. I'm not a girl. I can't comment on that.
Keep it. Yeah. Don't.
Yeah. No.
But, okay, so.
Politically correct.
We've not been sorry for the blonde jokes in this episode, but. We're just trying our best.
Do we have to have a thing that says for any blonde girls that were harmed in this? Like
we do. No, because we called them pretty, so it's fine.
A disclaimer.
Okay.
And you said they were smart.
Stop now. Okay. I did say that. Okay. Anyway, if you guys have any questions, I feel like this was super straightforward. But this was our Vertigo episode. We hope we helped you. And we hope you got a few laughs out too.
I love you, honey.
I love you too. Until next time.